Nora is our patient today, and we want to show you how to give her an eyebrow lift using some solid filler Pdo threads. And we're going to use the V-Soft Lift brand of lifting threads because they are the strongest, especially as you go to thinner sizes here. So come on in close, and we want to show you. I'm going to have you just sit up straight, Nora. Just sit up just like that, and you can come straight on at Nora. So take a look at Nora. We've got a few things that are going on here, just a little bit. Yep, just go a little bit straighter so you can see her straight on. So just look straight at the camera there, Nora. That's good. Take a look at her. She does have some hooded eyes, a little bit more on this side than on this side here. And she usually does have, she's already been all cleaned up for this procedure. She usually does like her cat eyes. We've removed some of that to clean up because we're going to be working in this area here, and possibly underneath in her eyebrows, eyebrow space here as well. But take a look. She is a little bit uneven too, which is what we're going to try to correct here. You can see more eyebrow space here, and then you go ahead and see here the curve in her eyebrows. She wants a little bit more of a curve. I'm going to turn you this way just a little bit. She wants to bring everything up a little bit and also bring the tail up a little bit. She doesn't want the real Spock eyebrows or real, a complete foxtail eyebrow like this. She wants everything to come up a little bit with just a little lift here. So it's really important to talk to patients exactly what they want. Same thing here. She still wants an arch in her brow, even though she wants the tail of this to come up just a little bit. So that's what we are going to try to accomplish with her treatment right here, right now. Megan Lynn, go ahead and describe what vectors are you planning as you go ahead and want to go ahead and do her treatment here.
So again, I'm going to lift straight up to maintain a little bit of that arc of the brow, and then another one coming out. That's going to give her just a little bit extra height. Then I will treat the other side that does have a little bit more of the hooding. So we'll do the same thing for our plan, but I anticipate that I might need actually a whole nother vector, just kind of splitting the difference just to give her the height in order to make them nice and even, because as we said, they're a little uneven right now. So we'll start with the sort of better side and then move on to the second side and do as many threads as we need.
All right, and that's the plan. Come and watch our plan.
All right, come take a look as we perform a brow lift using PDO, which is polydiaxanone lifting threads. In this particular procedure, we are going to be using the V-Soft lifting threads, which you can purchase at anewbio.com. Right now, you can see we had just used a ComfortTox syringe to administer our local anesthesia, in this case, which is the lidocaine, 2%, and we are now creating our pilot hole. So what this is doing is going to open up that space for our cannula and eventually our thread. You can see she's twisting the needle, sort of stretching the tissue in order to really open up that space for our cannula to just fall right in there. Sometimes it takes a little bit of wiggling, and you'll see she's gonna, there she goes, pops right into that plane, and it should just glide straight along. You can see she's just twisting that cannula in, advancing as far as she's able to go, which will be just into that hairline. And then once she gets into that plane, she's going to administer the smallest amount of lidocaine. You really don't want to administer too much anesthesia, otherwise you're not going to get a good lift. The more fluid that's in the tissue, the less the thread is going to be able to engage into the tissue. So again, just giving the smallest amount of anesthesia and then getting ready for that thread. The thread should go in very easily because we've already created that tunnel for the thread to go in. And again, she's just sort of wiggling that thread and just advancing it slowly, always feeling for where the tip of that thread is. And she's advancing all the way up into that hairline. Good. And then once ready to remove, she's going to twist the thread and exaggerating that lift with her left hand and pulling out the needle. And you can see her thread remains. Bleeding is totally normal during this procedure. This patient happens to be a little bit of an easy bleeder, so you'll see us for periods throughout the procedure where we're trying to control the bleeding. You can see what she did here was that reverse pull, and what this is doing is exaggerating that lift. With time, this will start to just settle a little bit, and so because of that, you want to over-exaggerate that lift. That way, once things settle, you still have achieved a lift. So you can see here the patient looks very comfortable. Again, we're using lidocaine to numb those vectors. And these vectors were selected for this patient on an individual basis based on what the patient's goals were and also what her anatomy is. So try not to get hung up on the vectors that you see here because they will be varying patient to patient depending on what the look that they're going for is and also what their anatomy is. So this patient in particular, she is asymmetrical from the left brow to the right brow. So even her vectors on the left side will vary from her vectors on the right. So we're going to start our second vector here, and again you can see we're using our needle to create our pilot hole, and she's going to twist the needle a little bit, stretch that tissue so that our cannula can fall easily into our plane. You will see here that our cannula is shorter than it was in our first vector, and that is just based on the amount of distance that we have to go here. You can see this vector is shorter, and so we've put on a shorter cannula. These are also can be purchased at a new bio, these cannulas, and so she's going to pop right into that plane again. There she is, and just slowly advance, always feeling where the tip of that cannula is. Even if it's a cannula, you need to know where the tip of your instrument is. And again, she's going to give a small amount of anesthetic, just enough to keep the patient comfortable, but not too much that we're flooding that tissue. And now it's time for our thread. So you can see here, she's going to just fall right back into that entry site. Good. And you can see how easily the thread advances, just a small amount of wiggling. She's usually using that left hand to help guide her thread less than the right hand. And you can see she's going up into that hairline. We'll show you here in just a second. You can see exactly how far up that thread is. Good. So if you sort of tent up on that thread, you can see we're all the way up into that hairline. Perfect. And then she's going to twist the thread, exaggerate her pull up of the brow, and pull the thread out. And again, we're going to do that reverse pull. We're really wanting to exaggerate that lift that you get on the brow. Look at that incredible lift. This is a patient that had pre-existing hooding, and we're trying to at least minimize the hooding that she has in the eyes and really give her that elevated brow. Perfect. Again, exaggerating that lift so you can see what we've accomplished here. Good. And then once we clip the threads, we'll show you how you can smooth the threads out just to make sure that all of the barbs have engaged in the tissue. Now, bruising and swelling should definitely be expected after a threading procedure, after all aesthetic procedures, but threading in particular. This tends to be one of the more advanced or invasive procedures that we perform. And so we should always educate our patients that, the risk for bruising and swelling exists. They should limit anti-inflammatories, any medications that could increase their risk for bruising for at least a week prior to the procedure. Okay, so again, we're going to lift that thread all the way up and then push with your scissors down to ensure that the thread, once clipped, will fall under the skin. You don't want to see any thread sticking out. And look at that lift. That is quite impressive, the lift that we have achieved on this side. So again, just controlling the bleeding here, and then we're going to show you how you should smooth the thread. So these threads, they are bidirectional, meaning you technically could smooth these by both directions to try and get those threads to engage. But try and limit the amount that you're pushing down because we really just want to achieve this excellent lift up. And so, do what you can to try and smooth those threads in an upwards fashion to, again, exaggerate that lift. Good. This looks remarkable. I cannot believe how much they were able to accomplish with just the two threads. So we're going to sit the patient up and take a look. This is always your opportunity to smooth any puckering, which can be completely normal. Again, if those threads have not completely engaged, you will have puckering of the tissue. You can see there is puckering above that left brow. It could be for a couple of reasons. Either one of the barbs has not quite engaged, not fully engaged in the tissue, or it could be due to swelling. So you'll see the injector is going to try and smooth this area out again, but look at that lift. You can appreciate already. Look at the lift on the left compared to her brow on the right. You can see how much we've accomplished in with just two threads. All right, so let's see if we can try and smooth this pucker out a little bit. You can see she's going upwards to try and exaggerate that lift. You can appreciate though, as her thumb is rolling over that area, this is a lot of soft tissue swelling, just from trauma from the procedure, but also because of the lidocaine that we administered too. There is additional fluid in the tissue just from the lidocaine alone. And so she's feeling to make sure that there's no barbs that have not engaged. And when we followed up with the patient the following day, we'll show you a picture afterwards. The pucker was completely gone the next morning. So, always reassure your patients these things can be expected. There's additional fluid on board and it will subside once the swelling calms down. All right, so we're going on to the next side. You can see we use the lidocaine to numb our vectors and then again creating our pilot hole with our needle, stretching the tissue out so that cannula can fall easily into that plane. Good, and here she is advancing along nicely. You can see she's checking the tip of that cannula so she always knows where the tip is, administering a small amount of anesthetic and now advancing her thread into place. And then for her second vector, we'll repeat the same thing. So using our needle to create the pilot hole and then advancing along. And now for our cannula. So this is our local anesthetic. This is our lidocaine to make sure the patient is nice and numb for the procedure. And now our thread. As you can see, the patient has tolerated this procedure really, really well. We are getting a nice mechanical lift here with these PDO threads. As time goes on, the threads will stimulate collagen production, which will help improve texture and improve the skin's texture and quality as well. So take a look at that lift. That is remarkable, and we will show you a before and after here in just a minute.